Hello students, hope you all are fine. Today we are going to start with our new chapter, that is growth and development of children. In this chapter we are going to study about their difference, various aspects, characteristics, etc. Today we are going to start with the concept of growth and development. Growth and development are generally used together to refer to the various aspects of an individual's overall performance. Growth indicates increase in body dimensions. We can measure this in terms of height, weight, and head circumference, whereas development refers to the different aspects of child's personality. It takes place in progressive manner, that is intellectually, physically and socially. Now we are going to study the difference between the two terms, that is growth and development. Growth is external in nature, we can measure it, and development is internal in nature. Growth will stop after some time after achieving the maturation, but the development is continuous throughout the life. Growth can be directly measured, whereas development is indirectly measured by drawing inferences such as intelligence. Growth refers to the maturity, whereas development refers to learning. Growth related to the heredity which we get from our parents, and development is related to the environment. If we are having healthy environment, we will be developed fully. Growth is a quantitative change, whereas development is the qualitative change. Growth is one of the aspects of development, whereas development is complex and has many sides. Growth is non-directional, whereas development is progressive and sequential. Now, we'll start with the characteristics of development. It is a continuous process starting from the conception and ending till death. Every individual passes through the same stages of life. One has to pass through each stage, like first childhood, adolescence, adulthood, then old age. From childhood, we can't directly jump to adulthood or vice versa. So this diagram helps us to study about the stages of life. Prenatal period is from conception to birth. Period of neonate, that is from birth to 1 month. Infancy stage, that is from 1 month to 2 years. Early childhood, that is from 2 to 6 years. Late childhood, that is from 6 to 11 years of age. Adolescence age varies in boys and girls, 11-12 years to 18-19 years of age. Adulthood from 18-19 years to 40 years of age. Middle age 40 to 60 years, and old age 60 years and above. So, one has to pass through all these stages of life. Next characteristics, it's a systematic process. Each individual goes through the same pattern, like child crawls first before walking, and before running he walks first. So it's a systematic process. Development proceeds from generic to specific. For example, a child learns to use his hands before using his finger. Third point is individual differences exist in development. Even the two siblings doesn't have the same rate. Next one, the growth and development rate varies at different stages of life. It means the rate of development is higher in case of infancy and adolescent as compared to the adulthood and childhood stage. Each development has characteristic traits of its own. The physical development is differ from the motor development. Heredity and environment influence the development of an individual to a great extent. Good heredity factors which we get from our parents, healthy environment which we also get from our home, school and society, and good nutrition leads to good development of an individual. Now we'll start with prenatal development. The prenatal stage is the time period from conception to birth, which takes around 280 days. However, all babies are not born exactly after 280 days. It takes about 266 days from the conception for a fetus to become biologically and physically ready. The first stage or phase is the germinal stage. This period is approximately 1 to 2 weeks long, or this is the period from conception until implantation. In this period, zygote is formed and it gets firmly attached to the wall of the mother's uterus. Second phase is the embryo. This period starts from the beginning of third week till the end of the eighth week. In this, all major organs are formed and heart begins to beat. Third one is the fetus stage. It lasts from the third prenatal month until the birth. In this, all major organs which are formed in the second stage are begin to function. In this, growth of the fetus is rapid. Fetus can hear the surrounding sounds, so you should have the happy environment around the mother. He can even taste the flavors of the food eaten by his mother. He can feel mother's heartbeat too. So, the fetus should have the supportive and caring environment so that it will ensure the optimum growth of the baby. There are various aspects of growth and development: physical, motor, cognitive, social, emotional, moral, and language development. We'll start with physical development. It refers to the increase in height and weight and the associated changes in shape and size of the child. These changes are in the body proportions as well. First criteria is weight. The approximate weight of an Indian child at the time of birth is around 3 kgs, which doubles at the age of 6 months and triples at the age of 1 year. At 2 to 3 years of age, his weight is approximately 12 to 14 kgs. Thereafter, the children grows by approximately 2 kgs every year. Next one is height. The average height of an Indian baby at birth is around 20 inches. A 1-year-old baby is 10 inches more than his or her height at the time of birth. A 2-year-old measures around 35 inches in height. Thereafter, the child grows approximately 3 to 4 inches every year. Next one is the body proportion. The head is around 1/4 of the body size. The legs and hands of the child grows faster during the infancy, and consequently the body proportion shows considerable improvement. Next one is the vision development. At the time of the birth, the baby's vision is blurred and it can see only a few inches far. The brain is unable to process the vision and make a clear picture of the object seen. However, the vision develops steadily and rapidly in the first few weeks of the life. Next one is teeth. The development Development of teeth is an important aspect of physical growth. Human being has two sets of teeth in life. The first one is temporary teeth, which is also known as baby teeth or milk teeth, which consists of 20 teeth. Second one is permanent teeth. Next we'll do the primary set of teeth. The child will have two middle incisors at the age of 6 to 8 months, four upper incisors at the age of 8 to 12 months, two lower lateral incisors at the age of 12 to 14 months, four first molars at the age of 12 to 15 months, four canines at the age of 18 to 20 months, and four second molars at the age of 20 to 24 months. It means around 2 years of age he'll have the primary set of teeth. So students, today we have covered growth and development, their difference, characteristics, physical development and prenatal development. In the next class, we will be continuing with this chapter. Thank you.